The Wellbeing Foundation Africa Field Project teams are proud to have commenced our Mamacare NICU Plus program initiatives by conducting our Neonatal Intensive Care Unit refresher training at General Hospital Ilorin and University of Ilorin Teaching Hospital, Ilorin, Kwara State. This refresher in-service training for NICU health professionals consolidates the last 3 years of program practices of the landmark partnership between the Wellbeing Foundation Africa and Neonatal Cares to bolster lactation care in NICUs and precedes the commencement of the Mamacare NICU Plus program, which aims to strengthen the promoting and supporting of breastfeeding among mothers and their newborns requiring intensive medical care.
My name is Amuda Aisha Tiyabo. I'm the matron in charge of NICU, and this facility we cater with neonates, with preterm, and with inborn and outborn babies. Actually, this unit is very unique in the sense that it's a delicate unit for babies because they can't express themselves. So they express themselves by crying, and through some tests we know what is wrong with them. So mostly we have preterm, we have neonatal jaundice babies, and the ones that are severe, they can't suck. So the use of the modeler machine is very important and essential, and for the preterm babies because they don't have that strength at all and their immunity is very low. So it's really a whole lot of a relief of stress for mothers and for we that are working here, because it's accessible to them and they are able to express the milk. So like the first milk that is very essential for babies, that is cholesterol. So for the preterm, they can't even suck at all. So we pass it through test tube for them through the NASA. So and they take it, and thank God it's really helping them, and they grow even faster because of the breast milk and via the machine that is pumping out the breast for them. And for the incubator, we feed them through it. Mostly when you are feeding them, even the incubator machine will be working because it doesn't disturb the breast milk and it doesn't tamper with the stem cells of the breast milk. In fact, the machine is very good, and it really helps the mothers, and they are so happy about it because they are able to pump out their breast, even the ones that they operated on. So it's just a two steps to NICU for them to come and pump the breast. That's why we put it outside at the edge of the door so that it won't be stressful for mothers to walk in and pump their milk.
What mommy said, that when you get to NICU, when you see those baby, you really see that they really need this support that we are giving them. In November, during the prematurity day, we were there, and we were looking at these twins that they are inside the incubator, and we see how they are still even fighting, trying to survive, and luckily with these provisions that we have in the NICU, these babies were able to survive.
This project was initially conceived by the Neonatal Cares. They are actually the manufacturer of the breast pump that you see in your NICU. So it was a partnership with them, and this presentation will really be focusing on that. So I'll be beginning my presentation introducing you to lactation and human milk initiative, which was specially designed for mothers and infants in the Neonatal Intensive Care Units. A brief introduction about our organization, the Wellbeing Foundation Africa. The Wellbeing Foundation Africa is a non-governmental organization founded by Her Excellency Barrister Toyin Ojora Saraki in 2004. And the aim of the organization is to improve the health outcomes for women, infants, and children in Nigeria and in Africa. And the foundation combines its programs with advocacy in Nigeria and all around the world to provide a robust support for its primary stakeholders, which are the women, the infants, and the children. As I mentioned earlier, this particular project was a partnership that was formed between 2020 and 2023, and it was aimed at delivering training to healthcare providers in 5 NICU facilities in Nigeria, and to empower them to utilize the Medela breast pump. As Mitchell mentioned earlier, we have the Medela breast pumps that we actually gave to the NICU facilities to actually facilitate this project. So the lactation tool, in addition to the breast pump, we also came up with the lactation tool, quality improvement tool, which actually upskilled and enhanced lactation and human milk knowledge, skills and expertise for the NICU, maternity and healthcare professionals.
Recognizing the numerous benefits of breastfeeding for both infants and mothers, including improved immunity, optimal growth, and enhanced bonding, WBFA acknowledges that premature infants in the NICU face significant challenges regarding breastfeeding due to their medical conditions and physical limitations. There are also serious health and economic consequences associated with not only breastfeeding. Globally, the World Health Organization and World Health Assembly have set a target to increase the exclusive breastfeeding rate to 50% by 2025. And while Nigeria has made commitments and taken important steps towards this benchmark, according to a recent national survey, only 29% of infants less than 6 months are exclusively breastfed in Nigeria.
Mo bímọ oṣù yèdè pé oṣù méje ló wáyé mo ti lò bí ọ̀sẹ̀ 5 báyìí níbí báyìí wọ́n dẹ̀ gbé sínú incubator láti gbà yẹn incubator tán gbé sí ó ṣe láǹfààní torí mo rí rẹ̀ pé ó ti wà òkè báyìí. Nínú náà ẹsẹ̀ discharge wa pé ká máa lọ. Màsíìnì yẹn ó ṣe wá láǹfààní. Mo rírì rẹ̀ torí agbádùn rẹ̀ lẹ́nu ìgbà táwọn lò.
Well, it has been a program helping our mothers so far so good when the program started. At least breast milk is the most important part of motherhood. And most babies getting access to breast milk on time, especially within the first 3 hours of life, is always difficult before the program started. But with the help of the breast pumps given to us, we are able to encourage mothers to express breast milk instead of buying formulas for their newborns. It has really helped both the mother and the babies, because with the help of the breast pump, as they are expressing the breast milk, there is an increased production of oxytocin, helping the uterus to contract and return back to its normal stage, and also helping the babies to have access to colostrum, which in most cases when the babies are sick, they don't get enough of it. But with the help of the breast pump now, the babies are able to access colostrum as early as possible.
The training is very interesting and it's so educational. At least from the training, we're able to say much about the importance of kangaroo. That is a backing of the baby, so that baby will have a skin-to-skin bonding with the mother. The benefits are so impressive.
My main duty here is to ensure that the mothers use the breast pump, to guide them on the proper use of the breast pump, and also to guide mothers on how to fill in the correct data that I'm collecting in the NICU General Hospital. And also for new nurses, because for a matter of time they have been recruiting new nurses in the ward, in the unit, so I put some of them through on how the breast pump is used properly. And I also stay back to make sure that there is no issue when using the breast pump and after using the breast pump, and to make sure that they are using the surgical and the surge protector for the machine, for the breast pump, so that it won't develop fault on time.
We have 2 nurseries
in UITH, the inborn and the outborn. The inborn, those delivered within the hospital, and the outborn, those delivered outside the hospital and brought to UITH. So I'm in charge of the one brought from outside. The machine for pumping breast was very, very effective. If the nipple is even a flat nipple and not too prominent, it will bring it out at once, and the milk will be flowing out. We can even put 2 mothers at a time to pump out the breast, and our babies were growing well, feeding them too early.
The use of automated expression, prior to the arrival of the Medela Symphony breast pump, mothers were taught how to express breast milk for their babies manually. However, this process is actually very painful. I'm glad to mention that this new machine actually made it painless for them. So this is part of the success that we recorded for the project.
It's just a refresher program, but we've done it last 2 years. And the Symphony breast pump is very effective. It has been helping us a lot in this unit, making us to get enough breast milk for our babies, especially the preterm babies, because most of them you have to feed them 2 hourly. Before then, to express breast milk manually was very difficult. If you call them, they say they don't have enough breast milk, no breast milk for the babies. But with this breast pump, we're able to get adequate breast milk for them. And the mothers are finding it very easy because it's not painful, easy to use, and they are expressing enough breast milk for their babies.
Basically, I come here to collect data, that's information on babies on admission, their date of birth and feeding and everything like that. So I come to collect data, and I also teach the mothers sometimes how to use the breast pump. That's new mothers that come into the Neonatal Intensive Care Unit. Sometimes I put them through on how to use the breast pump, as well as how to document how to fill the feeding chart and the expression logs.
But mo kọ́kọ́ dé ìbáyé first omi ọyàn mi ò jáde rárá. Pumping machine yìí ni mo lò tó fi help mi torí twins ni mo bí. Pumping machine yìí ló help mi tó fi di pé omi bá ti gbé sọ́mú báyìí kò ní pé bí 5 minutes or 10 minutes tí ọmú yẹn fi máa jáde tó máa rush jáde. Ó fi help àwọn baby mi. Wọ́n dẹ̀ fún wa ní ìtọ́jú tó péye ní ibi báyìí. Ẹ jọ̀ọ́ nítorí Ọlọ́run kí pumping machine ìbẹ̀rẹ̀ kó bá tó ń pọ̀ sí torí à ń tò fún kinní yìí ni. Tẹ́nìkan bá lò tẹ́nìkan tó máa dúró kò jẹ́ kí ó tún rí bí fast, but tó bá pé bí méjì àbí mẹ́ta ó máa tún fi help wa ṣe dáadáa torí kinní ìwúlò fún wa gan.
The Mamacare 360 NICU Plus program addresses these barriers by providing a comprehensive approach to breastfeeding support and education within the NICU setting. The WellbeingAfrica Foundation Africa offers specialized healthcare to initiate and sustain breastfeeding successfully, utilizing strategies such as breast milk expression techniques, the use of breast pumps, and other supplemental nursing systems, while also monitoring and evaluating the effectiveness of the intervention.
That we have a register that registers everything that's concerning a patient or a child. It makes it a lot easier. Then in 2 weeks, in 3 weeks, in 1 month, okay, you can go back to it and say, what did I record? God forbid, even in the era now these days of litigations, okay, people tend to want to ask for what is not. But if you have your documents properly, taken, it kind of saves you significantly.
Well, my final word for WellbeingAfrica, they should continue to do the good work they started. They should not relent on their effort.
So far so good, the organization is doing fine, though we can still do more by giving us more breast pumps. We have been encouraged that the mother should be expressing from the 2 breasts at the same time. That means a mother to a machine. So at least we have more, we're able to differentiate the inborn machine from the outborn patients.
WellbeingAfrica Foundation in Africa has done well, and is a form of recommendation. And I also want to encourage that this program should not stop now. it should still progress, because today we've been able to talk about breast milk donor. In a case of a rare situation where some children will need it, just like blood bank. So is a form of suggesting and also recommending. So you have done well. I want more efforts to see that we also have one breast milk bank in Kwara State.
My experience in NICU has been fun. I'm fond of children. I love children. This unit has brought me more closer to children. I've never seen a tiny baby before. I saw it first here, and it has made my love for children to increase and the care for children to also increase. And I've learned a lot about children. Children are not just like adults that when they have headache they complain or they speak out. Children, how they complain that they are in pain is through cry, or they start reacting funny. And I've seen so many babies that comes here looking so small, so weak, and when they are living healthy and strong and even bigger. It's just like a miracle, and I really want to thank Wellbeing Foundation for bringing me to this unit. I'm so grateful, and I'm interested, and I'm still willing to work in this unit.
Thank you for bringing this program to us. Even today's training was a very good one. We were refreshed. The program, all the things we've been practicing, and we were even the new things were added. We really enjoyed the program.
It's been a very beautiful journey, beautiful ride so far. I can remember the first time I heard a baby packed. I was quite pained. I got home that day and I was telling everybody, one baby packed where I was walking, one baby. It was quite painful for me, and then seeing babies, pretend babies, that was the first for me. So that experience made me quite, should I call it, it made me to pay more attention on this particular aspect of life. So one of the things I got to learn on this project is that there's actually a science to lactation. Lactation doesn't just happen, so to say. There's a science to it. I realized that if proper lactation would occur, then it must be initiated early enough. And for the babies here in the NICU, sometimes they cannot be latched onto the breast of their mom because of their conditions. So hence the reason why the breast pump is there, to help the women to lactate and all that. So I'm quite hopeful that this project will continue, so that at least based on the beautiful impacts and success stories we've had so far, we'll have more, and we'll be able to help more people ease their lives here. Thank you very much.